Welcome to tonight's webinar, This Too Shall Pass, How to Stay Stone Free, presented by Dr. Elizabeth Tourville. A native of Arizona, Dr. Tourville earned her medical degree at the University of Arizona College of Medicine in Tucson. She completed her urology and surgical residency at the University of Tennessee Health Science Center, Memphis. Dr. Tourville is a member of the American Urological Association. She specializes in kidney stone disease and minimally invasive surgery. She sees patients in Arizona Urology Specialist downtown Phoenix office. Welcome, Dr. Tourville.
Thank you, Jennifer, and thank you, everyone. So Jennifer already kind of gave me an introduction, but stones are one of my specialties and one of the fields I'm interested in. Kidney stones have about a 9% lifetime risk that affects about 1 in 11 individuals, with a peak in the 4th to 6th decade of life. Men are more likely to be affected by kidney stones than women. However, in recent years, this gap has been closing. Used to be that men were about 1.7 times as likely to get a kidney stone. Now it's more like 1.3 times as likely. And stones do account for a very large healthcare cost at about $4.5 billion per year. As anyone who's experienced a kidney stone knows, they can have a huge impact on your quality of life. They cause pain, can require you to take time off work, anxiety, and long-term consequences such as scarring or stricture formation, kidney damage, and recurrent infections or even sepsis. About 50% of individuals that experience a second stone within 10 years of the first occurrence. And in about 90% of patients, a metabolic cause can be found. However, metabolic evaluation and medical therapy have been shown to be very underused. Even though with dietary changes, lifestyle modifications, or medications, the stone recurrence rate can be decreased to less than 25%. I'm just going to briefly talk about some stone composition and the most common stones that we see. So calcium oxalate stone, this is actually the most common kidney and bladder stone. It's radio opaque, meaning that it can be seen on a plain x-ray, and it typically forms in urine with an abnormally low pH or acidic urine. Calcium phosphate stones are associated with a lot of medical conditions like hyperparathyroidism and medullary sponge kidney. They're also more likely to form in patients that use carbonic anhydrase inhibitors, which are medications used to treat certain conditions like glaucoma, altitude sickness, or epilepsy. They are also radio opaque, and they form in urine with an abnormally high pH or an alkaline urine. So cystine crystals, these form in acidic urine. They are radio opaque as well. Cystinuria is typically the cause of cystine stones, which is a rare genetic condition, so I won't get too much into that. Struvite stones are another one that can be seen on plain x-ray. They also form in alkaline urine, and typically they're caused by urinary tract infections. Uric acid crystals are one that cannot be seen on plain x-ray. They're radiolucent. They form in acidic urine, and even though they're uric acid stones, patients typically will have normal serum or blood uric acid levels and normal urine uric acid levels. So now we're going to discuss screening evaluation. Screening evaluation is used to stratify individuals according to high or low risk of stone recurrence. We look at personal and family history of stones, medical conditions associated with stone disease, such as osteoporosis, diabetes, gout, hyperparathyroidism. We look at diet, what you're eating and drinking, and also if you're on any medications that could predispose you to forming stones, like carbonic anhydrase inhibitors, the ones I just talked about, certain high blood pressure medications like hydrochlorothiazide, chemotherapy agents, and protease inhibitors. So urinary screening tests, this can be really helpful to basically try to figure out what type of stones a patient is likely to form. If someone has a low urine pH, then you're more likely to have calcium oxalate, uric acid, or cystine stones, whereas a high urine pH, you're more likely to have calcium phosphate or struvite stones. Additionally, getting a urine culture can let us know if you're at risk of having struvite stones, as those typically are caused by certain types of bacteria. Stone analysis should be performed whenever it can be done, as stone composition can implicate specific metabolic or genetic abnormalities, and can help direct preventative measures. So patients who should be getting metabolic testing include those that have recurrent stones, any multiple or bilateral stones at presenting, stones in both kidneys, first-time stone formers who benefit from metabolic evaluation and medical because they have a predisposing medical condition or on certain medications, or just sort of have dietary habits that put them at risk for stone disease. And then really just anyone who's interested in going evaluation, willing to take preventive measures to try to not have another stone episode. So metabolic testing consists of obtaining 1 or 2 24-hour urine collections obtained on a random diet and analyzed for things like urine volume, pH, urine calcium, oxalate, citrate. It's really important that patients adhere to their normal diet routines whenever the collection is being performed so that we can get an accurate understanding of what their normal urine composition looks like, and that can help us guide dietary recommendations. And we can also do a 24-hour urine collection after, dietary changes have been implemented or new medications have been implemented, just to assess if the treatment is working or not. Risk factors. Some modifiable risk factors include low urine volume, environmental factors such as living in a hotter, drier climate, which everyone in Arizona does, sedentary lifestyle. Sedentary lifestyle can lead to decreased bone mass, and that can lead to increased calcium in the urine, and excessive exercise, especially with poor hydration, because then you have lower urine volume. There are some inhibitors of stone formation, things that help prevent stones. Those include citrate, magnesium, and zinc, and we'll talk a little bit more about those later. Urine risk factors that we look at, again, urine volume. If you have high urine calcium, high urine oxalate or uric acid, or urine sodium. And then additionally, any type of extreme urine pH, so very high or very low urine pH, and low urine citrate. So moving on to dietary prevention. First thing we're going to look at is fluid intake. So basically, stones form when the urine is supersaturated with stone-forming salts. So we can decrease the formation and saturation of common stones if you increase your urine volume to at least 2.5 liters a day. Now, in order to make 2.5 liters of urine a day, that means you have to be drinking at least 2.5 liters a day, but you may actually need to drink even more than that depending on whether you have a lot of excess fluid loss. That can be from exercise, working outdoors, if you've recently been sick and having any GI issues like vomiting or diarrhea, or if you live in a hot, dry climate like in Arizona. So types of fluids that you should be drinking. We recommend any fluid that has a high citrate content. So basically that's, any type of water, Crystal Light lemonade, clear diet sodas, tea, coffee, even red or white wine or beer are good if they're, in moderation. The things that we do not recommend are carbonated drinks because those contain a lot of phosphoric acid, and that can lead to stone formation. So basically, any dark sodas. Moving on to hypercalceuria, or, high calcium in the urine. Essentially, dietary calcium is something that you want to consume in moderation. Just because you have high calcium in the urine doesn't mean that you should have low calcium intake. And the reason for that is that oxalate, which is another stone promoter, it actually gets bound by calcium in the intestine, and that creates this insoluble complex. So if you have too low of a calcium intake, then that can lead to this sort of unchecked absorption of oxalate in the gut, which then can lead to high oxalate in the urine and cause calcium oxalate stones. So that's why we recommend about 1,000 to 1,200 milligrams of calcium per day. It is preferred that the calcium is consumed in the diet. However, if you need to take a calcium supplement in order to reach that goal, we do recommend calcium citrate since it does include a inhibitor. So urinary calcium excretion is also influenced by urinary sodium. So, any increase in sodium in the diet will lead to increased sodium in the urine, which then causes increased calcium excretion. Essentially, we recommend that you limit your sodium intake to less than 2,300 milligrams per day, especially for hypercalciuric stone formers. Basically, what that means is that you should try to avoid high sodium foods, try to look for low sodium options, don't add any additional salt on the food, and try to use seasonings and spices that are salt-free. High sodium foods, so, basically a lot of seasonings, sauces, condiments, canned foods, fast food has a lot of salt in it, processed meats, salt preserved pickle foods. Those are sort of all the things to look out for and try to avoid. Next, we're going to discuss hyperoxaluria or high oxalate levels in the urine. When you have high oxalate in the urine, and then obviously you have a higher urinary saturation of oxalate, and that can lead to calcium oxalate stones. Things that can change your urinary oxalate levels include dietary oxalate intake, calcium intake, genetic factors, and then, your functional integrity of your GI tract. About 50% of our urinary oxalate comes from the diet. So we recommend that you consume, no more than 40 to 50 milligrams of oxalate per day. Calcium will bind to oxalate in the intestine. If you're eating oxalate, then it's okay to kind of eat higher levels of calcium with it. So that way the oxalate doesn't get absorbed as freely. A low-fat diet can also help prevent high oxalate in the urine. Basically, fat binds to calcium. So the more fat that you have in your diet, the more calcium gets bound, and the less calcium is available to, bond with the oxalate. So you want to try to keep your fat intake low. Additionally, vitamin C is converted to oxalate, so avoid high doses of that. Less than 500 milligrams per day is recommended. And there has been some evidence that shows vitamin B6 may reduce urine oxalate excretion. All the foods that have high oxalate are listed here. It's actually a lot of fruits and vegetables, so spinach, rhubarb, potatoes, beets, nuts, things like that. Now looking at Hypocituria. So as I said, citrate is a stone inhibitor. So low levels of that can lead to stone formation. Basically, citrate helps prevent stone formation because it binds to calcium in the urine, preventing calcium-based stones. The primary determinant of your urinary citrate excretion is your acid-base status, or what your blood pH level is. So when you're acidotic or you have a lower blood pH, it does increase citrate metabolism and reduce your citrate excretion. So there's less citrate in the urine, whereas alkalosis or high pH promotes urinary citrate excretion, which is better for preventing stones. There are certain conditions that are associated with acidosis or low pH level, making citrate less available in the urine. Those conditions essentially are chronic diarrhea, because you lose a lot of bicarb, which has a high pH in the stool. Thiazide use, which are used for high blood pressure. Those can cause acidosis. And then the carbonic anhydrase inhibitors, those medications that are used a lot for glaucoma or epilepsy, those actually prevent reabsorption of bicarb in the kidney and lead to acidosis that way. Some patients, it's just sort of unknown or idiopathic and don't really ever have a cause or reason for it. So in patients that have low citrate levels, essentially you want to avoid any foods that have a potential renal acid load, because those can, again, cause hypocituria and can lead to calcium oxalate and uric acid stones. Foods that have a high renal acid load include animal protein, cheese, and egg yolks. So you want to kind of limit your intake of those. Whereas fruits and vegetables have a high alkali load, and so it's good to eat lots of fruits and vegetables in that case. Different fluids that have high citrate contents include lemon or lime juice, clear diet soda, powdered Crystal Light, Minute Maid Light, Tropicana Light. While orange juice does have a high citrate content, it also has a lot of sugar, which can lead to stone formation. So you do want to just be cautious if you're consuming orange juice. So the DASH diet, this stands for the Dietary Approaches to Stop Hypertension diet. It's sort of listed over there on the right, but it has a lot of foods with a high alkali load. It's rich in fruits and vegetables And diets that closely resemble this have been shown in multiple studies to be associated with a reduced rate of stone formation. So a lot of times we'll recommend a DASH diet for patients that have low citrate in the urine. Moving on to hyperuricosure, or high uric acid levels in the urine. So animal protein accounts for about a third of our urinary uric acid excretion, and that includes all forms of meat, so fish, beef, chicken. Basically, you want to restrict your animal protein intake, because then you can lower your urinary uric acid and increase your urine pH, which puts you at less risk for uric acid stone formation. The reason why protein can lead to stone formation is because protein's made of amino acids, and those cause a large acid load, which makes your urine pH lower, therefore leading to low urine citrate, as we talked about, and also increased urine calcium levels. Purines, which is an amino acid, can also lead to increased urine uric acid, which can cause calcium oxalate stones. Purines are common in meats. So typically what we recommend is about, a half or 2/3 pounds of meat per day, which is about a serving, which essentially is about, size of your palm is what we say you should be eating in protein every day. Now we're going to discuss the various inhibitors of stone formation, things that can prevent them from forming. So magnesium, it inhibits calcium crystallization, and it also binds oxalate in the gut and the kidney, so it can prevent the formation of calcium stones, calcium oxalate stones. Additionally, when your magnesium is low, that's often associated with low citrate levels. We recommend 400 milligrams per day of magnesium. The supplement we recommend typically is potassium magnesium citrate, because again, it includes that inhibitor of citrate. You can find magnesium in lots of different foods like bran cereal, whole wheat pasta, beans, lentils, bananas, and dried fruit. The biggest sort of side effect from any sort of magnesium supplement is basically GI issues like diarrhea. So potassium, this acts by reducing urinary ionized calcium, and it also increases your inhibitor of that urine citrate. It does also provide an alkali load that promotes the citrate production and citrate excretion. We recommend potassium citrate. And in foods, it's in white beans, baked potatoes with the skin on, dried apricots, plain yogurt, bananas, avocado, tomatoes, and mushroom. So high dietary and soluble fiber. Fiber we recommend in moderation. So we recommend about 18 to 22 milligrams per day. More than that can lead to decreased water absorption and cause dehydration and lower urine volume. So you want to avoid too much fiber, but it does have benefit in moderation. That's because the main ingredient of fiber is phytate, which decreases urine calcium, increases urine citrate, and increases urine magnesium. And fiber is found in fruits, veggies, brown rice, rye barley, whole wheat bread, and beans. Fruits and vegetables. So these are natural sugars or unrefined sugars, which is good because that means that they are absorbed slowly. So there's no acute rise in the intestinal calcium absorption, and therefore obviously no acute rise in urine calcium excretion. They also have a high water content to help with hydration and increase urine volume, a high potassium and magnesium levels, low salt, high fiber. They provide an alkali load. The only thing about fruits and vegetables is you do have to watch out for those that have high oxalate levels, which basically is going to be things like spinach, kiwi, figs, and potato. So refined sugars, this is something that you want to avoid. Problem with refined sugars is that they get absorbed very quickly, and that leads to an abrupt rise in blood sugar and insulin levels, and that causes your intestine to absorb more calcium, therefore leading to an increased urine calcium level. So less than 10% of all diet carbs should come in the form of refined sugars, meaning less than 100 grams per day. Refined sugars are obviously in all sorts of delicious desserts like ice cream, candy, cakes. Also, the thing you got to look out for is high fructose corn syrup, since that is found in lots of different foods. Finally, we're just going to talk about some other preventative measures First one is body weight. Several studies have shown that higher BMI leads to a higher stone rate and recurrence. Therefore, weight loss can be beneficial, but you have to be careful about how you go about it. It can be helpful if you're exercising, using good hydration. You're not exercising to the point where you're, having low urine volume because you're dehydrated, or if you have any sort of, restrictive bariatric surgery. It can be detrimental if you are, doing diet like Atkins, where you're just eating a lot of high animal protein, you're abusing laxatives. That leads to, again, a lot of bicarb loss and causes you to be acidotic. If you're exercising but you're not hydrating well, or if you've had a gastric bypass, because that can essentially alter the way that certain substances are absorbed. Immobility is a bad thing because it leads to bone mass loss, and therefore when your bones are broken down, it causes increased calcium levels in the blood and then increased calcium in the urine. Exercise is obviously good for a lot of other reasons as well. It reduces your blood pressure, inflammation, it improves your insulin sensitivity. Insulin, levels abruptly rising lead to increased calcium and cause, calcium stones and cause a change in your acid-base status, which can lead to stone formation. And again, it's really important to stress that exercise is a great thing, but you have to make sure that you're hydrating well. And this is just sort of a summary of the, dietary recommendations. So, if you have low urinary pH, you're more likely to form calcium oxalate stones, uric acid stones, and cysteine stones. If you have a high urinary pH, you're more likely to form struvite stones and calcium phosphate stones. For any stone former, you should be drinking enough fluid to make over 2.5 liters of urine a day. If you have calcium oxalate, uric acid stones, or cysteine stones, you want to be increasing your citrate, your inhibitors that you're consuming. Calcium oxalate stones, again, you don't want to limit your calcium intake. You want it to be in moderation to try to control your oxalate in your urine. Uric acid stones, other big thing is making sure that you're decreasing your animal protein intake. Struvite stones, associated with urinary tract infections, you want to make sure that those are appropriately treated. And calcium phosphate stones, you want to decrease your sodium intake and treat any associated conditions like hyperparathyroidism or gout.
Okay, I'd like to thank everyone. Dr. Tourville is available for in-person and telehealth appointments. She sees patients in our downtown Phoenix office. For more information or to make an appointment, please visit us at arizonaurologyspecialist.com, where self-scheduling is now available. Thank you so much and have a great evening.